with her.
So once again, good evening, everyone. And we have always we have conducted these training sessions. One of them is healthcare training sessions. I'm sure you have been attending all these training sessions now. And today it's going to be exclusively only question and answers. So based on all the trainings that we've had, or the recruitment process that we are following at RSR Global, I request all of you all, if you all have any questions or queries, doubts regarding any part of the recruitment or the process documents or anything regarding the eligibility criteria of the candidates required for the various sub verticals for healthcare recruitment, please ask them now.
Ma'am, I have one question which you already had told, but then also, can you bifurcate that IELTS requirement for nurses and other healthcare candidates?
Like Manisha previously explained about hospitality, English proficiency test and other things. So please, can you brief us for healthcare also?
Yes, sure. Once again, I'll just clarify how it's very simple. It's not between the nurses and other healthcare professionals. It is between the HCAs or senior carers and other healthcare professionals. Okay. Now, if you classify the English proficiency requirements, basically you can classify them into two requirements. Okay. One requirement is for the senior carers or healthcare assistants. Okay. Another requirement is for all other medical professionals, including doctors, allied healthcare professionals, dentists, and nurses. Okay. So all the other categories will come under the other part of the classification. Now, the first part, that is for the senior carers or HCAs. Okay. What English proficiency certificates they require? If they have a bachelor's degree, okay, if the carers who are applying for a carer's job or HCA job, if they have a bachelor's degree, for example, if they have done bachelor's in nursing, or if they have done bachelor's in psychology or social work or any kind of a graduation, they are eligible to apply for the ECTS certificate, the ECCTIS, ECTS certificate, which can be gotten from the website online by submitting their MOIs, that is the medium of instruction in English, which they need to submit from their universities. And based on that, they will be getting their ECTS certificate. Now, this ECTS certificate is valid for lifetime. Okay. So the candidates who have a bachelor's degree, they have an advantage by applying for an ECTS certificate, because this certificate does not have an expiry date like that for IELTS or OET. Basically, the other proficiency certificates like IELTS and OET, they have an expiry date 2 years from the date of issue. Okay, so they have 2 years validity, whereas ECTS certificate is valid for lifetime. Okay, so this is one certificate which they can get, that is only for the carers or HCA. Remember, ECTS certificate is not acceptable for any other healthcare professionals. Okay, so ECTS is only allowed for healthcare assistants or senior carers. So under this classification, you can have an ECTS, or you can have a UKVI IELTS General, or an IELTS UKVI IELTS Academic. So the candidates who are applying for a carer's job, yes, the candidates who are applying for carer's job can also give a UKVI IELTS General examination, or they can go for UKVI IELTS Academic examination. But the minimum score requirement for that is 4 and above. Okay. For academic examination, for UKVI IELTS Academic is basically that's meant more for the nurses, the other healthcare professionals. But it's not that these people cannot give it. Even the people who are candidates who are applying for carer job or healthcare assistant job, can give that examination, but it's a little tougher than compared to the UKVI IELTS General. Okay, so these are the proficiency certificates that can be gotten or that can be accepted for the carers or the senior carer jobs. Okay, the healthcare assistant job. Now, the other part of the classification. That includes all the healthcare professionals, including doctors, allied healthcare professionals, nurses, and dentists. For all of these who come under this category, they must go in for a UKVI IELTS academic certificate. They have to sit for that examination, that is a UKVI IELTS academic examination, and they must get a score of 7 and above in all the modules. Okay, they must get a score of 7 in all the modules. Only and only for the nurses. Okay, they have one leverage, that is, it is accepted a 6.5 band in module of writing is accepted for the nurses. Like, for example, if in a UKVI IELTS academic examination, if they have given in all the other, speaking, listening, reading, they get 7 and above. But in writing, if they have a 6.5, it is acceptable to be applying for a nursing job. Okay, but this is only and only for the nurses. For all the other healthcare professionals, which I mentioned in this part of the classification, they must go for a UKVI IELTS academic examination with a minimum score of 7 and above. Okay. Now for speech therapists and people who are more into the communication part, like speech therapists and all these kinds, their requirements are more. Let me tell you that. They have to get at least 7.5 and above. Okay. For them, the requirement is more. Okay. But these jobs we don't have very frequently. Okay, but just in case if you are working on those jobs and if you have candidates coming in for that particular job role, you have to specify that the requirements are more, 7.5 and above. Now, another English proficiency certificate that is acceptable for this part of the classification, that is including the doctors, the allied healthcare professionals, the dentists and nurses, is the OET, Occupational English Test. Occupational English Test with a band B and above, B and A, B plus A, all those. Okay, so they can go for 2 English proficiency certificates, that is the UKVI IELTS academic or an OET, with the required band score which I have mentioned. Okay, so these are basic 2 simple classifications for the healthcare professionals in general. Okay, now again, the registration processes are required for all the healthcare professionals. That's a different thing. English proficiency requirement is a different thing. There are 2 criteria to be able to work for their particular field in the UK. They must have two important certificates. That is the English proficiency certificate with the required IELTS score or required band score. Another one is the registration certificate of that particular council in the UK. Okay. So these 2 certificates are a must to be able to apply for whichever jobs that they are looking for. Except for carers. For carers, they don't have any registration certificates. They just have to have an English proficiency certificate and an experience in this particular field. I hope this is very clear.
Thank you.
Okay, very well. Any other questions? Hi, Dr. Gupta, how are you? Thank you for joining.
I am good. Hello, everyone.
Hi, sir. Hello. Madam, I have a question.
Yes, please.
If a candidate has done 10+2, are they eligible to apply for caretakers?
See, we get many candidates who have done their 10+2 and they have done some certificates and have been working as carers with few years of working experience. Although technically, I'm not really very sure. Technically, these candidates are eligible, it seems. Okay, but what Mr. Rajesh has told us that we should not consider these candidates because sometimes they can get stuck up with their visa. Okay, and given yes,
what if they have diploma? What if they don't have a degree, but they have
yes,
diploma?
Yes, I've always been saying this, that we consider for carers, we consider only those candidates who have a 3-year diploma, who have done a 3-year diploma, okay, or a bachelor's degree. Now, 3 years diploma is considered, okay, that is acceptable. A bachelor's degree is of course acceptable. Like we have so many nurses who have done diploma in nursing, that is GNM, that is a 3 years nursing course.
Yes.
So they are very well eligible for this to apply for the carers role, okay, although they have a diploma. So we consider a 3-year diploma course, okay, or a bachelor's degree. But given, I mean, we have, these candidates who have done this 12th grade and then they have done this certificates and have been working as carers. Comparatively, we don't prefer those candidates because of the very fact that, now we have like so many diploma and these degree nurses available, because we are looking for quality candidates, So obviously these candidates would have a better, they will have added advantage over the ones who have just done their 12th and have been working as carers. So we prefer those candidates compared to these, right?
So, madam, which degree should they have? Is it a BSc?
They can have any bachelor's degree, okay? If they are applying for a carer's job, they can have any bachelor's degree, even BCom or even BA. Maybe BA they have done in social work, or there are a whole lot of graduation in different fields.
Yes, ma'am.
But they must, to add to that, they must have either a kind of a certificate course or a formal training that is considered. If people are not coming from a medical background, then they must ideally have some kind of a certification to show that yes, they have formal training in the carer's job. And also they must have an experience. At least 1 to 2 years working experience is a must for these candidates. Okay. Any other questions?
Madam, what about the registration process for doctors? Okay. I think I missed the first 10 minutes.
Yes. No worries. I'll repeat it again. Now, for doctors, they have to be GMC registered to be practicing as medical doctors in the UK. They must be GMC registered. Now, you were asking the other day which doctors. All the doctors come under this category except for the dentists.
Okay.
Dentist, they have that other registration, that is the GDC, General Dental Council. So they are registered with that, whereas the other doctors, whether they are psychiatrists or whether they're gynecologists or ophthalmologists or like whole lot of cardiologists and the other specialties, if they have to be working in the UK in their particular field, they must be GMC registered. Now, again, to be GMC registered, first of all, they have these 2 exams which they have to give. That is the PLAB 1, PLAB, PLAB 1 and PLAB 2. PLAB 1 is given in their own home country. Okay. Online. PLAB 2 is given in the UK. PLAB 2 is more of a practical based examination. So they have to go to the UK either on a visitor's visa or whatever. They have to give the PLAB 2 over there. Once they have successfully passed the PLAB 2, then they get their registration. They have to apply for the GMC registration and they get it. Okay. And once they get the registration number or the PIN, they can apply for a job to be working as doctors in the UK. Right. So this is the eligibility criteria for doctors to be applying for doctors, doctor's job in the UK. Right.
So, madam, they do have only 2 registrations, like GMC and PLAB. They need only 1 registration, ma'am? GMC?
Yes, GMC is the registration. PLAB 1 and PLAB 2 are the exams they have to give to get the GMC registration. GMC registration, it's not like that you just apply for the registration and you get it. It's not like that. Like just for the nurses, when I told you how nurses go about, Nurses have to give the CBT, that is a computer-based test in their own home country, then go for the OSCE in the UK, and after passing the OSCE, they get their NMC registration pin, because of which then they become eligible to practice as nurses in the UK. So same way even for the doctors, they have to give the PLAB 1 examination, pass that, clear that, plus the second examination, that is the PLAB 2, and after having passed the PLAB 2, they get their GMC registration, right? I hope it is clear to everyone. In fact, any other questions?
I request everyone to please ask your questions. Please put up your questions because this is the only session, question and answer session for the healthcare in this month. Next month, there would be no question and answer session on healthcare. So please ask your questions.
Okay, so no worries if you all don't have them and if things are very clear. It's very nice. Yes, Ashfaq bhai, go on.
Referring to today morning's screening session where I had one of my candidates. So I was just thinking that maybe she was answering some of your questions properly, but missing some important points as well, like the bedridden patients, what are the basic care protocol or something. So is it possible if we can get up, I mean, for their preparation, so that they just don't miss any important points, if we get some basic questions and the main answering points so that they can prepare accordingly.
See, for the first screening, we always suggest do not give your candidates the clinical questions. It's very important because otherwise the entire intention of assessing their caliber or assessing them goes for a toss. Okay, because we need to understand where they are with their knowledge and experience, how genuine candidates they are, first of all. Okay, and how much knowledge they have. If you're going to give them clinical questions right during the first screening, then it becomes, and they come well prepared with all that, it becomes very difficult to assess where they exactly stand. So we request all the offices, you can train your candidates for the during the pre-screening. If you all are getting your candidates for the first time, you all can train them regarding the introduction, the presentation, the technical preparation and everything. But do not give them clinical questions related to that particular field. It's not only about healthcare, but also about maybe if we have hospitality, IT engineering, those kind of those technical questions. Do not give them the technical questions in the first round. When we help our candidates with the entire training information or the details or the material is when they are going for the final interviews. Before the final interviews is the actual time when we actually share with them all the material that we have with us. In fact, all the website links and videos and whatever that we can, because of course that is the time that they must outperform rather, right? I hope this is clear. So please do not prepare your candidates for the first screening with the clinical or the technical questions. No. Just let them come with their knowledge. Even if they ask you what questions am I supposed to or what am I supposed to prepare for, just tell them you have to be updated with your knowledge and your experience. That's all. Right? Okay, so thank you all for taking time and joining us. And I think most of the question and answers are covered. And nevertheless, if you all have any more questions, I'm always reachable. So please do not hesitate to contact me and I'll be more than happy to answer the questions again. Okay.